I got the text. Yes.
We're live on Facebook.
Excellent. Success.
Oh my Lord. You should see how many texts I have. Everyone, at least 18. Hey, you're live. No kidding. I can't see it. All right. All is well. Anyway, welcome to Just Start with Jane. There are those leaders who shine above all in assisting their organizations to greatness. And my guest today is one of those leaders. We call her an early adopter. And even though like Tammy, you are definitely one of my favorite humans on the face of the earth, even though we are polar opposites. Like we are more polar opposite than Sue and I are polar opposite, which is so weird. So I'm deeply honored that you would do this with me twice this morning, not just once, but twice, to tell your story. So my guest today is Tammy Quall. Her title is the Chief Administrative and Strategy Officer at Access Community Health Center. She is not our usual initiative champion in that she works in a very urban area, the fine city of Madison, Wisconsin, where you have several clinics that serve behavioral, mental health, and dental for the underserved, so throughout the Southwest Wisconsin area. So our topic this month is alignment. And behavior change is really, really hard. And, people tend to think of mission, vision, strategy as bricks and mortar type stuff, right? As things that, okay, well, stroke of the pen, we're going to build a new building, build it and they will come. We're going to start a new service line. And that's a strategy, whatever. But really, when you get down to it, what you guys have discovered on your mission and excellence journey to greatness, which you've been extremely successful at, is that behaviors. We're really asking people to change their behaviors. So we coach everyone. Okay, you got to have goals, got to have strategy, got to align them with the big picture and then cascade them down to the front line of the organization. And for you guys, that's several buildings all over a city in Southwest Wisconsin with physicians and providers and, social workers and interpreters and frontline employees and leaders, and make those goals alive. And, one of the reasons why I asked you to come and talk to me this morning twice is because what I see the strength of your organization, and I don't even know if you realize this, is that you're not an organization like some are that just throws pasta up on the wall and sees what sticks. That when you do something, you do it well, and you do it so it's sustainable, and you do it with the thought in mind that it works for everyone. And not everybody's like that, right? Not everybody's like that. And so sometimes failure comes. Like you may not be successful because you didn't want to just do it. You didn't want to just cascade goals down to the front line so that you could say, oh, it's done. Next coaching call with Jane and Sue, we can say it's done. And not always good. So when we talked in preparation for today, obviously not by testing our technology, but when we talked in preparation for today, you said, hey, before you have me on your show, just so you know, like I don't feel like we've always been successful at this. And you know what? Failure is powerful. Failing and learning from failure, giant. So tell me about this learning phase.
Sure. So, Jane, just a little bit, thank you. First of all, thank you for that introduction, and thank you for having me here today. It's really an honor. And I was thinking back, we started our journey with you and Sue in 2017. Mm-hmm. And we're different than a lot of your partners in that we're urban. We're also not a hospital. We're primary medical, dental, and behavioral health. And in 2017, we found ourselves, we had, when over probably about a 10-year period, we had gone from being a small organization with one clinic and providing medical services to, medium size. We have a $30 million, $35 million a year budget. We serve about 30,000 patients a year. And in 2017, we were still in many ways trying to run the organization like it was a small organization. And when we were smaller, we would develop a very thoughtful strategic plan, and then the senior leaders would really drive it. And in 2017, we have 5 clinics, 3 major service lines, multiple partnerships. We have a school-based dental program where we're serving children in all of the Madison and elementary schools and Sun Prairie elementary schools. And we're trying to cascade, or we're trying to rein in and have strategy across the organization. And I remember being at your C-suite event at the Edgewater, and it was either you or Sue, and you were talking about how without the gold cycle, that you told a story about senior leaders fighting and big personalities, and I'm like, oh my God, that's us. Have they been watching us? Because we're highly intelligent, competent people with great, strong ideas about how to get things done, and we were oftentimes working at cross purposes. Sure. So I would say really aligning the goal setting cycle as an organization and aligning it to strategy has been transformational in our leadership team over the past few years. And we've, in terms of having us work together, be on the same page, have the same messages, I think we've been able to accomplish a lot of things that previously we really struggled to accomplish as a leadership team. So that's some of the success stories that we've had with the goal cycle. Where we've struggled is to have a meaningful cascading goal process with our employees across all sites. And the first time we launched it was in 2018, and we followed all the rules. We met with all of our leaders. We gave them the agenda for the meetings. We had training on the anatomy of a goal. We did everything. We had a big launch. People met with their teams. They submitted their goals. And it just it sort of just fizzled. It didn't have this strong employees weren't feeling it just didn't, it wasn't meaningful. And so we tried to study and adjust, that's a big we don't even though it failed, I would say we don't talk about it that way or internally. It's like, okay, what did we learn from this? What was successful, because there's always some success, and then what didn't happen the way we had hoped, and let's how were we going to shift this? So then in 2019 we did a second round, which I think went better. So it would have been fiscal year 20 for us, I think. And but still not, there just wasn't this meaningfulness, I think, with staff yet. And some of so then we kind of ran up onto COVID, which stopped everything in its tracks for us as an organization. And we have some lessons learned from that as well. But some of the lessons that that we learned kind of from the challenges is we probably, if I was going to go back and do it over again, I would wait a year before we cascaded the goals.
Oh, really?
Yeah.
So you would start at the senior leader and leader role before you cascaded down to the employees, or even just senior leader?
Yeah, I think, yes. Absolutely. Senior directors, maybe managers. I think I would do more work with our leaders, so they really fully understood the process, what we're trying to accomplish. And I think that has happened in a lot of ways through the process. But I probably would have focused on that and not rushed to try and take it to staff. And for a few reasons. As an organization, for many reasons, we haven't been data rich. And that was a struggle for us then to provide our leaders with the data that they needed to be able to have measurable, meaningful goals that contributed to the larger pillar goals. So that was one challenge we had. The other challenge was how we define a department. We're five clinics and an administrative office. We have at our big clinics, we have medical, dental, and behavioral health services. And then at the two smaller clinics, we have standalone dental clinics. And we've struggled. Is it the medical practice? What about our support services? Where do they fit in? And if you get at the clinic level, it gets to be a pretty small group of people. So I don't think we've completely answered that question for us organizationally. Is it, in a hospital, is it your nursing department and so I think that's something we're still struggling with to figure out what our department is organizationally, and then how we would cascade. The other thing that we really, I think, struggled with was, again, many leaders just struggle with the concept and keeping it in front of people. And I think that I think we've gotten better over the last couple of years of our leaders having sacred time and not having being caught up in the whirlwind, but that's something we still struggle with. And I think oftentimes that, how the clinic, we're understaffed, we're this, we're that, we've got a clinic run for the day. I think that competition with this more strategic work is something that we continue to struggle with as well.
Well, that's what you definitely have in common with the hospital, for sure. Yeah, the whirlwind isn't kind to anyone.
No, it's not. And so and if you're, as you well know, a frontline leader, making sure those patients get taken care of that day is always going to take precedence over everything else.
Sure.
So so in maintaining the focus on the goals was a struggle.
Right.
So then fast forward to March of last year, where in many ways we were sort of stopped in our tracks, and in part our dental practice is about as big as our medical practice. And as you can imagine, COVID really has transformed dental care.
Absolutely.
And
circa hazmat suits.
Yes. And so we actually had to shut down our dental practice for a number of months, and then try and find the PPE we needed, because there was some scarcity, and an organization our size doesn't have huge buying power. So purchasing power. And so then as we were bringing people back on in the dental practice, we had to redesign the medical practice. Our behavioral health team, who were sitting side by side, our physicians in an integrated model, are now largely doing telehealth visits. They're actually busier than they've ever been, but we redesigned our entire practice across all three service lines.
Right.
And what was interesting, in reflecting back now, is the lessons we can learn about, people were aligned and the staff were really engaged in the process of redesign. We had to figure out how we could be really productive and not at the same time reducing our aerosol generating procedures in the dental team and the dental practice. And our plan to do this year is to really look and to engage our leaders in, okay, this was essentially crisis induced cascading goal of
maybe Sue and I need a new name for it. Crisis induced goals.
Crisis, yeah, because many of the behaviors that we wanted to see when we were rolling this out in 2018 and 2019 were displayed throughout COVID as we made this rapid changes and this measuring, and are we accomplished, particularly in our financial, in terms of productivity, are we accomplishing, are we filling the schedules, are we, how are we, right. How are we mixing telehealth with the in-person visits to maximize the schedule? How do we flex based on the number of COVID, and we have to have more patients in our respiratory clinic versus less? And so our goal this year is to really dissect all of that. And my hope would be that next year we have a new cascading goal cycle based on all of the lessons that we've learned really over the last 3 years.
Great. Let's call it the silver lining cascading goal cycle. Well, one last point that I'd like you to expand upon before we end our time together. And I didn't forewarn Tammy of this. Smart girl, she thinks on her feet. But one of the things that I've always been extremely impressed with, and that 99% of our partners would literally kill for, honest to God, is the engagement of your providers and physicians. Mm-hmm. I mean, when I'm, standing in front of an audience at Access Community Health Center, there's just as many frontline leaders that are, dentists and physicians and, psychologists as there are a nursing leader. And they are as equally engaged. And I know that's just every day for you, but do you remember an action that you took to, hey, Dr. Kevin, who remarkably looks like Ted Danson, what's your goal this year, buddy? Like, you remember, do you think it was an expectation of Ken because he's a physician, or what do you attribute that amazing physician and provider engagement to? Mm-hmm.
Well, I would say it's probably a number of things. We are extremely mission driven. As a federally qualified community health center, we exist to serve individuals who are underserved, either uninsured or have language barriers, or we have a very, very high acuity of mental health and substance abuse issues in our patient population, very high acuity. And so the providers that work for us they're there, they could work in other places and probably have less stress than they have working in, but they really believe in what we're trying to do as an organization, and that healthcare is part of the equalizer in our society in terms of justice and equity. And so that attracts individuals who are highly engaged to start out with. Mm-hmm. And then we have, and I think this is the team that Dr. Loving, our CEO, has built. And our provider leaders are fabulous to work with.
Oh, yeah.
They're amazing and thoughtful, and in terms of and thinking ahead in terms of strategy, and really believe in this work. And all of our three chief clinical officers are so amazing to work with in the journey. And I think that's the team that, I think that's been very deliberate on Dr. Living's part of building a team that believes in this and will move it forward. So it's I would credit kind of those multiple factors.
Sure. And the leadership bundle and setting goals is part of it. And
Yeah, absolutely.
they're part of that. Well, it just so happens that Sue is live with Dr. Ken Loving on Monday. So you guys got to check that out. If you think Tammy is fabulous, so is Dr. Ken Loving. And gosh, we love his name. The great news is, in closing, Sue and I are speaking nationally today at the National American Hospital Association Rural Conference virtually. Obviously, I'm not in Phoenix. And so we're very excited to be on Zoom talking with over 1,000 healthcare leaders across the country about goal setting. Yay! And alignment. So also catch us in Galena, Illinois, April 27th through the 29th. So again, that is a deep dive on a goal setting workshop. And as Tammy explained, you learn some things at these live presentations. All right, Tammy, always a pleasure. Sorry for the kerfuffle.
It's good to see you, Jane.
Yes.
It's always an adventure.
Yes, it is. Bye.
All right, bye-bye.